Hi, I'm Snigdha Sharma, and you're listening to Three Things, the Indian Express news show. In this episode of Three Things, we discuss the findings of the central team of experts from the three worst affected states by the coronavirus pandemic. We also discuss the shortage of Remdesivir, and in the middle of all this, the Kumbh Mela in Uttarakhand. Beginning with the findings of the expert committee. Last week, a day after the Prime Minister held a meeting with all the chief ministers to review the country's dire pandemic situation, the Ministry of Health and Family Welfare sent teams of experts to three states of concern, Maharashtra, Punjab and Chhattisgarh. All three have been reporting the highest number of new COVID-19 deaths in the country. From the lack of oxygen supply to the shortage of ventilators and lack of adequate testing, the teams have reported a host of issues from each of these states. In fact, Maharashtra alone is contributing to more than 48% of the country's active caseload. So to find out the details of what these teams have found and understand where we currently stand in terms of the pandemic, we spoke to Indian Express's Kaunain Sheriff. He began by telling us about the team of experts.
The reason for sending these teams to these three states was because they were reporting the highest number of deaths, which is a big cause of concern. So that was the reason why these teams were sent. In the next, as the graph you're seeing is unfolding, the government has also sent teams to other states, including Gujarat. These teams consist of public health experts, doctors who have clinical expertise, and people who are in the epidemiology department. So basically from the community health department. So these teams are looking at four specific things. First is, of course, testing numbers, whether there is an infrastructure of testing or whether there is shortage of testing. Second is basically on containment and contact tracing, which is one of the most important tools to control the pandemic and the ways that containment is being done. And third, of course, is related to the hospital infrastructure, whether it is the oxygen availability, the ventilators, the beds. So basically, three different aspects of the COVID pandemic and how the gaps are now being witnessed in these states. And that is the reason why we are actually seeing a significant mortality in these three states. So they have submitted the reports now to the Ministry of Health, who have now then given specific directions to the principal health secretary at the state level to look into it at a very urgent basis and plug in those gaps.
So the findings from Maharashtra point towards very high hospital occupancy, shortage of oxygen supply, and even malfunctioning ventilators. Kaunain gave us more details.
So we know that Maharashtra is contributing the largest amount of cases in the country. Almost 500,000 cases are active cases in the state. The weekly positive rate is as high as 25%. That means out of every 100 samples, 25 samples are turning to be positive. So Maharashtra is the cause of concern, and right now Maharashtra has reported a total death of is almost touching 60,000 deaths. So Maharashtra, the biggest red flag has been related to the availability of the beds. In fact, three of the districts, which are surge districts, Nagpur, Aurangabad, and Ahmednagar, they are showing almost 100% occupancy rate. So what it means is that if the beds are completely filled up, then patients who actually require, who have severe disease and require hospitalization, for them, then there'll be a delay in hospitalization, which is actually then triggering more number of deaths in Maharashtra. So that's a big cause of concern. The health ministry has said to set up additional beds in these three districts so that we bring the mortality rate under control. Then Aurangabad, there's another problem that the neighboring districts of Aurangabad are completely dependent on that particular district, which is why there is again the beds are completely full. It's like Delhi when we see surge in neighboring districts of Western UP and in Ghaziabad and in Noida, then you see that Delhi gets filled up, its beds gets filled up. So it's the same thing that is happening in Aurangabad. So you're seeing that there have been several media reports on there's a huge shortage of medical oxygen supply. So the most important treatment is oxygen therapy in COVID-19, whether it's for the moderate disease or the severe disease. So it is highly recommended that once the saturation level of oxygen goes below 90, then it is also advised that the patients are put on oxygen. So it is a very important aspect, not just on treatment, but also to reduce the mortality or the death. And there are as many as 4 districts which are showing now a huge shortage of oxygen supply in Maharashtra. And the biggest concern, of course, has been Pune, which is reporting the maximum number of cases. Pune also has a significant shortage of oxygen supply. And then there's a new issue that has cropped up in Maharashtra related to ventilators. Although ventilators are not widely used, it's only used in the last stage of treatment. But there are 2 districts, which is Latur and Satara, where the teams have found that the ventilators are not functioning. So there's the improper functioning. And then there's a big problem, which the center had flagged more than 15 days back, that if there is a big surge, then your entire health infrastructure will get overwhelmed. So there is an acute shortage of healthcare workers in Aurangabad, Yavatmal, Satara, Jalgaon, and 2, 3 other districts. All these are surge districts. So there are not just shortage of doctors, but also shortage of doctors who have to monitor the ICU, who are specialists in respiratory diseases. So there is a huge shortage there. On this specific thing issue, the ministry has said that they recruit someone from outside on contractual basis, on urgent basis, and use the national health mission funds for this purpose. And then, of course, the 2 big issues which the center has been flagging about Maharashtra is testing. Testing here, especially the RT-PCR numbers, are not touching 70%, which is what the government recommends. So, testing capacity in Satara, Palghar, Amravati, Latur are all, there is huge shortage of testing there. And which is why there is a delay in testing, and that's why you have large number of cases being reported late, and again, which is leading to death. The last aspect, like I pointed out earlier, is related to containment and surveillance, especially in Aurangabad and Sangli. They're saying that the surveillance is completely lacking. People with even mild symptoms of influenza like symptoms, which is cough and fever, are not being tested. And contact tracing in Nanded, Satara, and Aurangabad is very limited due to manpower shortage.
In Punjab, the team of experts reported low rates of testing, lack of COVID care centers and dedicated hospitals, and shortage of healthcare workers.
Punjab is a small state but reporting very large number of deaths. The biggest red flag has been about SAS Nagar and Roopnagar districts, 2 big surge districts. In fact, the central team has said that there is no dedicated COVID hospital in SAS Nagar, and all the patients are being referred to Chandigarh. So, which means that till you're referred to Chandigarh, and it is a luck that you find a bed in Chandigarh. Otherwise, there is a delay, and which is causing the deaths in Punjab. Also, for people with mild symptoms, there are no COVID care centers in Roopnagar. So most of them are in home isolation. And if you're in home isolation, there is no good monitoring by the government authorities through calls. So if there is no good monitoring, then you are spreading the virus at home, and people elderly are getting infected because of that. Then again, there's a big problem of ventilators in Punjab again. There's a huge shortage of healthcare workers in Patiala, SAS Nagar, and Roopnagar. And there's a big problem also of testing in Patiala. In fact, in Roopnagar, there is not a single RT-PCR testing lab. So we are seeing a huge surge that has happened in Punjab in the last 2 months, but there is no RT-PCR testing lab in Roopnagar.
And finally, coming to the team's findings from Chhattisgarh.
So you must remember that Chhattisgarh is a state with not very robust health infrastructure. So it is a state which has this disadvantage because it does not have a very robust private sector, private healthcare sector, mostly dependent on the government hospitals. And the virus is not just in Raipur, but has traveled to several other districts where the infrastructure is really bad. So with Chhattisgarh, it is related to how the entire health infrastructure is not prepared for this huge surge that is happening in Chhattisgarh. In fact, Chhattisgarh is now reporting third largest number of deaths in the country for such a small population. So the biggest red flag has been, again, like I told you, hospital bed occupancy rates are high in Raipur, which is the capital, Durg, Balod. So they have told them to ramp up the ICU beds. So if you look at the numbers, in fact, those on oxygen and ventilators, it's almost 100% occupancy. So that's a big problem there. In fact, there's a huge shortage of Remdesivir, which is an antiviral drug used for severe patients. So that's a big issue in Chhattisgarh. And like Maharashtra, again, there is a problem of oxygen supply, even in the capital, Raipur. And like again, like Maharashtra, the entire system is being overwhelmed, and there are no doctors in Durg and Jashpur, which are the two big surge districts. And the reason why we are seeing again a big surge in Chhattisgarh is because the containment and surveillance is very inadequate. The contact tracing is almost negligible in at least two districts. In fact, there has been a big flaw of how you are actually drawing boundaries in a containment zone in Chhattisgarh. In fact, you're seeing cases coming out outside the containment zone, which clearly means that you are not targeting the containment zone in the right way.
Now, two other states, apart from these three, have also become a cause of concern. They are Uttar Pradesh and Gujarat. The surge in Uttar Pradesh has now become a cause of worry, and the testing numbers in Gujarat too are a serious issue.
In Uttar Pradesh, the big cause of concern has been the testing numbers. In the video conferencing, the center has flagged that the testing numbers have come down significantly. And in Gujarat, in fact, three teams are there right now in Surat examining the gaps related to the worsening situation and on testing. These teams also will then travel to Rajkot, Baroda, and Ahmedabad and review the situation. And we would soon see a similar sort of a analysis and a report being sent to the center from these places.
And now coming to Remdesivir. While the effectiveness of this antiviral drug has been the subject of much debate, it is being widely used around the world for the treatment of COVID-19. And as we battle the second and what seems like a much fiercer wave of the virus, hospitals across Maharashtra, Delhi, Gujarat, Chhattisgarh, and Madhya Pradesh are running out of this drug. However, there is more to this shortage than the apparent reason, which is the rising number of cases. To understand why we are facing this shortage, how it is affecting the country's COVID response, and how it is being fixed, we were joined by Tabassum Barnagarwala, who reports for the Indian Express from Maharashtra. So, Tabassum, if you could start by explaining to us briefly the importance of Remdesivir in COVID treatment.
So Remdesivir has been a drug which has existed since 2014 when it was first introduced for treatment of Ebola virus. Eventually, they used it for treatment of SARS and MERS, which are also sister concerns of coronavirus infection that we are seeing now. In the latest infection of COVID-19, this drug was repurposed in 2020. And since then, there have been multiple clinical trials going on to study the effect of remdesivir in COVID-19 patients. It is still a debatable drug. It's an investigational drug where we are seeing all kinds of studies which are suggesting that it is working really well. It is able to prevent mortality and severe infections. And there are studies which are actually finding that there is no effect of remdesivir on mortality at all. This is still a drug which is under debate between clinicians and doctors, and we still need to wait for more data to understand how important this drug is in COVID-19 management. But having said so, this drug is being used very commonly by doctors in patients who are mildly symptomatic and who've just been infected. Say, for example, you've got COVID-19 infection symptoms today. If this drug is given to you in the next 4 or 5 days, it is considered to be very effective. What this drug does is it reduces the viral load in the lungs and it prevents the virus from replicating itself. So if a person has chances of turning into a severe category, that may be prevented with this drug. There are mostly 6 doses given per patient, injections which are given intravenously.
Right. So now coming to the important question, Tabassum. Apart from the obvious reason, which is the rise in cases, why are we facing this shortage?
Last year, when there was a peak in September in India, the demand for remdesivir was high. Eventually, what happened was the manufacturers began scaling up their production capacity. And suddenly, in October, November, December, and January, we saw that there was a lull in COVID-19 cases. Across India, we were seeing a gradual decline, and the demand for remdesivir suddenly shot down. Because of this, the stockpile which a lot of manufacturers had, distributors had, stockists had at their level, they had huge stock and they had absolutely no demand to cater to. Few of them were also supposed to liquidate their entire stock because there were no buyers at all. Because of which, from January till March, a lot of manufacturers scaled down their production because they did not anticipate rise in supply and they also did not anticipate the COVID-19 cases to rise so quickly in India. In February, when the cases started rising, production was still at its all time low. And in March, it is when manufacturers realized that there's a need for remdesivir, there's a demand from private and public hospitals, and they started ramping up their production capacity. Now, in March, the manufacturers began scaling up their production, and we started coming across a huge acute shortage around somewhere around March end and April beginning. What manufacturers are telling us now is that by mid-April or by April 20, the supply of remdesivir will be equalized. They'll be able to match the demand which is there in the market. But till then, we are going to see that there's going to be an acute shortage everywhere. You're already seeing complaints from Madhya Pradesh, Maharashtra, Gujarat, even Rajasthan and Punjab to some extent, Delhi, where there's a shortage. Soon we'll see these complaints coming up from Uttar Pradesh, where the cases are rising slowly. The shortage is also because there's an overprescription that we are noticing across all private hospitals. The use in a government hospital is much less as compared to a private hospital. Doctors are trying to please patients by providing them all kind of treatments, be it plasma, be it remdesivir, be it tocilizumab, and a lot of patients are being given this drug even when they don't require it. This is an investigational drug. It still has contraindications. Its usage has to be as per a clinical protocol which has been laid down by the government of India. But very few hospitals we are now seeing are actually following this.
So, how are these issues being dealt with right now?
So different states have been asked to do different, have been basically asked to take their own call and issue directions to ensure that there is no rampant misuse happening of remdesivir, there is no black marketing, and there is no hoarding happening. Just to give a reference, Maharashtra has today issued a series of directions for usage of remdesivir. Each physician or doctor who's prescribing this drug has to explain why they are using it. They have to justify the reason for using this drug in a patient. There's a form that they have to fill which gives all details of oxygen saturation level, lung involvement, all the other clinical symptoms that the patient has, so that if there is an inquiry, the government is able to see why this patient was given the particular drug and what were the clinical conditions that the patient suffered from. Apart from that, Maharashtra is also reducing the supply chain. They are trying to shorten it up by removing retailers from the whole picture. So a manufacturer has to directly sell this drug to a stockist or to a collector or to a COVID-19 hospital or to a pharmacy which is attached to a hospital. So when they do this, they're basically removing the multiple players involved in the process, and the follow-up of the drug from manufacturer till the end point will be easier to track down. So these are some steps that they've taken. I believe Madhya Pradesh is also trying to do something similar. Madhya Pradesh is trying to buy the drugs directly from the manufacturers and supply it to hospitals so that there are very few middlemen involved. Also, because we saw some examples of how in Gujarat there were some 5,000 vials which were procured by a BJP chief. In Nagpur, where Union Minister Nitin Gadkari said that he has asked Sun Pharma to supply 10,000 vials. So these are questions which now opposition members are asking as to how politicians are able to place orders for remdesivir when it is a strictly regulated drug. That is something even the FDA is working on, and manufacturers have been strictly instructed to not supply it to anybody apart from licensed holders.
So, next, Tabassum, if you could go on to tell us a bit about the manufacturing cycle of remdesivir.
The entire cycle of remdesivir takes about 20 to 25 days. It takes 4 to 5 days for the production. It's produced through a process called liquidized remdesivir, in which they convert the liquid form into a powder form. Once this is done, the entire stock is supposed to undergo a 14-day sterility test. And once that is done, they have to transport this in specific temperature, which is 2 to 8 degrees, similar to what vaccines require in India. And then the transportation takes 2 to 3 days. So the entire process will take anywhere between 20 to 27 days from manufacturer's end till the hospital end, till it reaches a hospital or a pharmacist.
Okay, so which are the pharma companies that are currently manufacturing remdesivir and at what scale?
Currently, there are 7 manufacturers in India: Mylan, Hetero Healthcare, Jubilant Life Sciences, Cipla, Dr. Reddy's Laboratories, Zydus Cadila, and Sun Pharmaceuticals. Together, the 7 manufacturers are able to produce somewhere around 38.80 lakh vials per month. The government now has asked them to scale up to their maximum capacity. We are hearing that Zydus plans to increase its capacity to 12 lakh vials per month. There is another pharmaceutical company called Kamla Life Sciences, which supplies to Cipla. And they plan to have liquid remdesivir. Liquid remdesivir is a easier process. It is faster than liquidized remdesivir. and they plan to have 2 lakh vials per day. So by that logic, they'll have at least 60 lakh vials per month. They plan to scale up their production by mid-April. So most of these pharmaceutical companies are ramping up their capacity. Hetero produces 10.5 lakh vials, and every day they are producing some 35,000 vials and distributing to different states. So the demand is huge, and these manufacturers are trying to scale up to the best of their capabilities.
Right. So, on that note, Tabassum, if you could tell us what are the manufacturing and supply related issues that are being seen right now?
What a lot of officials are telling us at this point is that as fast as this demand is rising, we will find that after a month or 2 months, the demand is again going to suddenly drop. And these manufacturers are a little scared that there might again be a situation that they witnessed last December when they have a lot of stock and very few buyers. Because this drug is only used for COVID-19 treatment. There is no other treatment for which remdesivir is used at this point. So that is one concern that manufacturers have. Another problem that is there at this point is that in the entire supply chain, the manufacturer sells this drug to a distributor. The distributor will sell it to another distributor or a wholesaler. The wholesaler will sell it to a pharmacist, or there'll be a stockist who will be involved in the whole process, and then they will sell it to a hospital or directly to patients. Now, because the supply chain is really long, it is easier for the drug to get diverted at different points in the chain. For example, there could be a retailer who's making an entry of selling 6 vials to a patient, but he's actually selling just 2 vials, and he's siphoning off 4 other vials and just inserting them in the black market. It is also possible for hospitals to allocate 6 vials to a patient, and we've seen cases where nurses and ward boys have diverted 2 or 3 of those vials into the black market. Once it enters into a black market, then the prices inflate. And that is exactly what we are seeing right now. The prices of this drug are anywhere between 5,000 to 10,000 at the cost at which a customer or a patient is buying these vials at. And the actual cost is between 2,400 to 5,400. Different manufacturers have different rates. For example, Cipla is selling it for 4,000. Zydus is selling it for 2,800, and they've just announced that they're going to sell it at rupees 899. Hetero is selling it at rupees 5,400. Dr. Reddy's lab is selling it at 5,400. Mylan is selling it at rupees 4,800. And Jubilant is selling it at rupees 4,700. So these are the MRPs which are there of the drug. But when a customer or a patient is buying them from the black market, because there is a shortage in the regular supply chain, he's buying it for rupees 8,000 or 10,000. So then that treatment becomes very expensive because a patient requires at least 6 vials, which will cost them around 60,000 if they buy it in the black market. And that has become a cause of concern.
And now coming to our final segment. As we go through one of the worst phases of the pandemic with increasing deaths, shortage of medicines and hospital beds, in Uttarakhand's Haridwar, lakhs of pilgrims have gathered at the foot of the Himalayas by the river Ganga for the Kumbh Mela. Pictures are all over the internet of thousands of saffron-clad sadhus, ash-smeared nagas and other devotees flouting basic COVID-19 norms and gathering at the ghats for a holy dip or the second Shahi Snan of the Kumbh Mela. The Mela administration claimed that approximately 17.31 lakh devotees had taken the holy dip in the Ganga till 10 a.m. on Monday. Around 10,000 security personnel are deployed to control and supervise the crowds in Haridwar and Rishikesh. While the Uttarakhand High Court had mandated that everyone would have to carry their RT-PCR negative test report and had also directed the state government to ensure the use of sanitizers and masks, Inspector General Sanjay Gunjal said that a stampede-like situation may arise if the police try to enforce social distancing at the ghats. The Uttarakhand police, meanwhile, is using artificial intelligence to zoom into those not wearing masks. Officials said that over 350 CCTV cameras have been installed at different locations in the Mela area, with about 100 of them equipped with sensors. The sensors generate an alert when the camera captures an image of a person without a mask. These AI-equipped cameras also generate an alert when sites identified as vulnerable for stampedes see a higher crowd density. The cameras are also being used to keep count of vehicles at parking lots and to spot objects lying unattended for more than 10 minutes. Uttarakhand is among the states displaying an upward trajectory in daily new cases. On Sunday, the state had registered more than 1,300 new infections. You were listening to 3 Things by the Indian Express. Today's show was written and produced by me, Snigdha Sharma, and was edited and mixed by Suresh Pawar. You can follow us and leave us feedback on Facebook or Twitter at Express Podcasts, or send us an email at podcasts@indianexpress.com. And if you like this show, please do subscribe and leave us a review wherever you get your podcasts from so more people can find us. You can also look for us in the audio section in the top right corner of our website, indianexpress.com.